Hello, this is Sonam Manoj, pain psychologist, Alleviate Pain Center, Bangalore. Now, a typical psychological plan of a patient starts anywhere between, say, 5 sessions to about 12 sessions. This completely is subjective to the patient, to the pain condition, and how much we need to work on it. Now, in the first few sessions, say about 1 or 2 sessions goes on evaluating the problem, evaluating where you stand, where the patient is coming from, what is the history like, what is the pain perception like, and more importantly, what is the goal of the patient? What does the patient want from these therapies? Keeping all this in mind, a tailor-made structure or a tailor-made therapy is planned for the person, and we move forward from there. Our therapies are planned keeping the 3 important factors in mind: the bio, the psycho, and the social factors. When all of these are in tandem, when all of they have a common meeting point, we see that the patient moves in very, very fast and in a much better manner. Now, keeping this in mind, the usual therapies that we use are cognitive behavioral therapy, in which we look at changing behaviors, either introducing new behaviors that will help you better, make your life and your quality much better, and also deleting some behaviors which probably have been forming a lot of obstacles or have been giving you challenges otherwise. The other therapy that we use is acceptance commitment therapy, and this really helps like miracle in pain management. Acceptance and commitment is basically accepting where we are today and taking a committed action to making sure we move on in a much better manner. Except for these 2 therapies, we have many more therapies that we use which are very subjective to the patient, like hypnosis, we have imagery exercises, we have a lot to do with other mind and body connection therapies. These are usually subjective to the patient and the pain condition. Meeting a pain therapist, a pain psychologist is always a great idea when you're going through chronic pain, or if you've had an injury, if you've had any kind of traumatic events that you've gone through. Definitely make sure you see a therapist and get yourself a tailor-made psychological plan. At Alleviate, we do all of it.